Hello and welcome to another episode of the D.A.R.E podcast, partnered with City AM. And our guest today is a living legend in the City of London. His name is Charles Alexander CBE, and he is the chair of Guy's and St Thomas NHS Foundation Trust, which is the largest NHS Foundation Trust in the UK. His background includes being a managing director at Rothschilds. He was president of GE Capital Europe. He has served as a non-executive director for many publicly listed companies. He has been the deputy chairman and a director of English National Opera. And he has also been the chairman for the Royal Marsden Hospital, which is a fabulous global hospital focused on cancer and fighting cancer. Now, welcome Charles Alexander to the D.A.R.E podcast.
Hello, Miranda.
So we, of course, know each other because I'm a non-executive director on the Guy's and St Thomas NHS Foundation Trust board. So let's start at the very beginning. What were you like as a child? And I know we've had previous conversations where you've given me a glimpse of your childhood, but what were you like as a child? And did you have aspirations to have a career in finance and health?
I was a lucky child. My mother and father moved to Liverpool after the war. They had a war career, each of them. And my father worked in shipping in Liverpool for 37 years. And I had a very happy and stable childhood. So all the mistakes I've made are entirely my own fault. But so I come from the Northwest. And what was I like as a child? Well, I was a competitive child because I had competitive parents. I think those of my generation who were the original baby boomers, born literally during rationing after the war, our parents wanted a lot for us. And from my very earliest memories was my mother and father wanting to improve their lot in life, and for myself, my brother and my sister to do the same. And
I don't know if you want to share, the fact of who your mother married versus your aunt, because I thought that was quite a nice story.
Yeah, my mother was from a working class family. Her mother had come over in service from Ireland at the turn of the last century but one. And so she was brought up in South London and moved into private education because she was very lucky. At the age of 11 in 1931. She got a scholarship and went to London University to read maths, was evacuated to the war to read maths, and ended up at Bletchley, where she spent the rest of the war before marrying her childhood sweetheart, my father, who came from a different background in South London. He was the son of an engineer. So needless to say, in my mother's family, she was very lucky. And one of her sisters, my beloved Auntie Edith, wasn't quite so lucky, and so remained very happily in the background that they both came from. And they were quite different, really. Their outcomes were quite different, which just showed as a definition of what social mobility, for want of a better term, looked like in the immediate post-war period.
Yeah. So you've clearly had a successful career within finance and now in the boardroom of the healthcare industry. How did you get into finance, and how did you make the transition from finance into healthcare?
Well, how I got into finance, to be perfectly honest, was a bit of an accident.
I think it is for most of us, actually.
I was at that time when I was at university. I was at Oxford University, and at the time, lots of people, different organisations came round on what was known in those days as the milk round, coming around to interview undergraduates. And so the milk round included the intelligence services, the Foreign Office. It included some industry, not much, local government, the BBC, in those days the advertising industry. It was before the days of management consultants, but above all, the city institutions. And those of us like me who didn't quite know what to do, to be perfectly honest, but we had a very, very good training and very good degree in logical extrapolation, expression, the formation of opinions and the interrogation of facts. I sort of fell into it, really, like a lot of others. I didn't really want to go into the BBC or local government or advertising. So Rothschilds at that time, like the other city firms, were extremely good recruiters and very good employers. So I fell into it at the age of 21 in September 1974.
Wow. And then you just worked your way up, all the way up to
Yes,
MD?
I did. I was an internationalist, and I served in Italy and Latin America. I ran the Rothschilds Latin American business, and then the later part of a 25-year career there in the continent of Europe. So I learned the languages that I had to speak. You have to speak Italian if you're selling Eurobonds to the Vatican. I learned that quite quickly. Similarly, in Latin America, you have to speak Portuguese and Spanish in order to help privatize the gas industry. So I was in an international field with government and non-governmental clients, really focusing on different forms of inward direct investment into the emerging markets. And that I did for a very happy 15 years before coming back to the continent of Europe, where the Rothschild houses were beginning the process which led to their consolidation.
So what advice would you give to someone who wants to have a career in finance or maybe healthcare?
Well, in finance, get a better training than I did. I would concentrate on the nuts and bolts of, as most people in finance currently do, whether it's in accountancy or in business studies or all of that. So I would definitely do that. And secondly, I would learn one or two traits which get you a long way in the financial services industry, which are underestimated. Punctuality, for example, respect.
Yeah.
Don't take anybody or anything for granted. So it's a very exciting industry. It has a bad name amongst some commentating classes, if I can put it that way, but it's been a mainstay of the British economy and the European economy, as well as the United States and the Far East. So it's a core industry for this country and for our European neighbors. And I think it's an exciting industry and will be for the foreseeable future for a young person, man or woman, from whatever their background, to get into.
Definitely. I think for me personally, I also entered the financial industry, City of London, Bishopsgate down the road. And I was 18, I was a teenager, and I fell into it, quite honestly. Yeah. And I think sometimes that's what you do, and you end up having, a multi-decade career within finance. Yeah. It's a good industry to be part of. Yeah. Of course, we met, and now we're on the board of Guy's and St Thomas NHS Foundation Trust, which is what you chair. How did you make that transition? How did you enter the healthcare industry? And what was it about the healthcare industry that attracted you to it?
Well, two things. Firstly, I had actually had experience of healthcare at different points of my life. So in what would now be called a gap year, I had worked in full-on apartheid South Africa.
I remember you told me. Yes, share this story.
No, in a full-on apartheid South Africa, in a black hospital in a white area, as that shameful period of history was shamefully called. And therefore I was a medical assistant. I helped restrain mental health parents. I delivered bad news to bereaved parents. I essentially was an acolyte. I was a servant to the nurses, all of whom were Zulu and who were marvelous people. Yeah. So I fell in love with healthcare at that point. And at university, for a vacation job, I looked after a disabled child. And later in my career, I became a volunteer at Trinity Hospice in London. And therefore, I've always had this feeling of wanting to be close to healthcare as an interesting industry. How I got into healthcare later on in my career was when I was looking for a portfolio career. All my friends and everybody, headhunters and everybody else, said, whatever you do, don't touch the NHS with a barge pole.
Oh dear.
Which was just like a rubber bullet to an elephant, as far as I was. It just made me angry. And so, having touched it myself in the past, I thought, right, I'm going to be interested. And after a number of false starts, I stumbled into applying, actually through the newspapers, to chair the Royal Marsden. As you say, the Royal Marsden NHS Foundation Trust, which is a specialist tertiary cancer research and care hospital or hospitals in West London. I spent 6 happy years there, and then was people were kind enough after I was timed out, because as you know,
there's a limited time.
Chairs and non-executive directors have fixed terms, quite rightly, and they were kind enough to ask me to put my hat in the ring to chair Guy's and St Thomas's, which I did, and I've been doing that for 2 years now, and it's different from the Royal Marsden because it's a much broader church than the Royal Marsden, which was a specific cancer centre and extraordinarily good at it. Guy's and St Thomas's also has a very good cancer centre, but has a number of other things as well that it does, including the Royal Brompton and Harefield, and community care, and increasingly contact with primary care, as well as research through King's Health Partners, and partnership and collaborative working in South East London. And so it, for me, was a chance to be involved with an extraordinarily talented group of people at a time of considerable stress caused by COVID and other things, and pressure on public finances, to name but two, to help navigate, to help teams of people fulfill their potential and do what I could to assist.
Which is a reason why I joined. I mean, I've always been part of the healthcare industry, mostly on the charity side, whether it's cancer, kidney, but there's always been that aspect of healthcare. And of course, last year you helped moderate a panel on ESG. For those that don't know, ESG, E is the environment, S is the social, G is the governance, and then we added the plus, the H for health.
Yes.
And it was all on addressing ESG plus health inequalities, which was really addressing health inequalities. What more do you think we should be doing? Not just as a board at Guy's and St Thomas NHS Foundation Trust, not just as an industry in the healthcare, but within the UK and beyond. What more can we be doing to help close the ESG plus health inequalities gap?
Well, on ESG, first of all, I get pretty fed up with the trope that you see in public discourse at the moment, which is certain politicians and others stand up and say they are fed up with EDI, equality, diversity, and inclusion agendas, and all of this. I think people who attack that work have very short memories. They certainly never sat in a hospital in apartheid South Africa. And I believe that it is absolutely essential for the quality of life, for the quality of society, and for the quality of care, particularly making it healthcare specific, that the industry is as inclusive as possible and reflects the society it serves. And this is not just a cliche. This is something that a lot of us hold, and I have been trying to, throughout the whole of my career. I was an ardent, and still am, by the way, an ardent globalizer. I know that we're a diminishing band these days, but I believe in globalization, and I believe in global talent. And I think we are extremely lucky in this country largely through our language and our time zone, to be able to welcome global talent. And so I'll get to your point about health inequality in a second, but what makes me believe so passionately in the equality, diversity, and inclusion aspect of our society and our work in the health service is that it makes for better care, a more balanced workforce, a higher quality workforce, because of the capturing through equality of opportunity the talent that's out there from whichever quarter, including a lot of all the protected characteristics. So I believe passionately in that, and I will continue to be an advocate for it. So far as health inequality is concerned, it's a highly complex subject, health inequality. And I hesitate to produce any panaceas, and I believe that a lot of people who talk about health inequality don't actually know what they're talking about. But for where health inequality exists, it exists not so much in statistics about, in my opinion, not so much in statistics about life expectancy, as about education, access, and hope. And above all, hope. And I strongly believe that leaders in the NHS, and I hope that the executive at GSTT and the Royal Master and the ones that I have been involved with, as well as partners all over London and the country, if nothing else, are believers in offering hope to the population they serve. So, more specifically, access to primary care. Access to primary care, good quality, efficient, fast primary care, by which I mean in the broadest sense primary care. So faster diagnosis, faster access to prevention education, faster and equal access to all of those things. I could go on for hours about it, but that is in the saying you are not in a hopeless situation, unlike your neighbours half a mile away. And that seems to me to be a responsibility that we all bear.
And you definitely do walk your talk, because one of the things you did as the new chair of the Guys and St Thomas NHS Foundation Trust is launch the very first People, Culture and Education Committee, which is what I chair. So when it comes to the focus on inequalities and how do we focus on that, not just from a staff workforce perspective, but also from a patient perspective, that's really important. So we're coming to the end of this conversation. In terms of boardroom inclusion, sustainability and corporate governance, what more do you think the boardroom should be doing to make organisations more sustainable and more inclusive?
Well, first of all, they need to set an example. A board needs to set an example to staff, and the workforce and to patients by their own behaviour and conduct. What more could we do? Gosh.
We'll get you back for part two. There's probably not enough time to go through that.
But we can do much more.
Yeah.
But I think if I go back to what I was talking about earlier, access, education, and the diffusion of hope. So the remodeling of the workforce as well towards the delivery of care closer to the home, of the breaking down of barriers between prevention, primary, secondary, tertiary care, community care, and so on. It's all part of a remodeling enabled by digitization above all, of a health service, all of whose patients are possibly Amazon customers. The health service needs to turn itself upside down from a place to which people come into a service which provides people the service to people in their homes. Yes. So it needs to turn itself 180 degrees from a outward in to an inward out provision. And when it does that, then it can reach everybody. It has no excuse not to reach everybody, because it's not sitting there waiting for them to come to us. We are going to them. And we have no excuse at that point not to make it a more equal service for all.
Totally agree, Charles. So the D.A.R.E podcast, it's all about successful mindsets. You're clearly successful. You've had a very successful and privileged career to date. 2 questions I want to quickly wrap up. So is there anything else you'd like to achieve in your career? And have you ever done any successful mindset tactics like visualization, vision boards, affirmations? Have you done anything like that as well to achieve your goals?
Goodness
so
me.
2 questions in one.
All right, first question, I'd like to be a better grandfather. No, but do I have? No, I'd like to actually, to be perfectly honest, I work in 3 areas at the moment. I work in music, but we can leave that aside.
I know, the opera, yes.
We'll leave music aside, but I work in music education. But in terms of the 2 areas which I'm involved in my chairmanships in public service are the health service and social housing through a chairmanship of Vivid, a housing association in the south of England. And I guess what my remaining ambition is to leave the boards of those organisations in a better place than I found them. Firstly, secondly, which was already very good, but to feel that public service and service of the health service and social care and also social housing, are not poor relatives. They are able to live in harmony and cohesion with the rest of society. And this division between public and private sectors can be broken down. And if I play a small part in doing that, I'd be very grateful.
Great. And do you have any success mindset tips?
Success mindset tips, yes. D.A.R.E, you explained to me, Miranda. The D.A.R.E acronym. Well, I think you challenged me earlier to say,
what do you dare our audience to do?
What I would dare your audience to do is I would dare your audience to challenge.
Yes.
Challenge the accepted wisdom. I can say that it's helped me very much in my career, that lots of things that are accepted as true, accepted as obvious, and accepted as correct aren't necessarily. And so I was trained as a historian where I had to learn the facts, interrogate the facts, read and listen to the opinions of others, form my own opinions, and then express them concisely under time pressure. I would advise people to take that mindset, interrogate the facts, form their own opinions, and with respect and clarity, challenge accepted wisdoms, because it's amazing how often you find that there is a better way than those that are being commonly suggested in society to solve problems.
100%. I totally agree with that. Thank you so much, Charles, for being a guest on the D.A.R.E podcast. It's been an absolute pleasure to have you here.
Well, my pleasure, Miranda. Thank you very much for asking me.
Thank you. On that note, thank you very much for joining the D.A.R.E podcast, which is partnered by City AM. I'm Miranda Braun, the founder and the producer. And don't forget to subscribe, follow, and remember to follow us next time. Thank you very much for watching and listening.